Welcome to our channel. Today we're gonna through the practical quiz on pelvis and pelvic visceral anatomy part 1, and the next video we'll do part 2. Please be attentive because you may be asked like this question is in your card and the exams like a medical student. In this tutorial, I'm going to read the questions and examine yourself to find the correct answer, and then after I will show you the answer and explanation to each question. Let us start on the first question. First question. The part of uterine wall which is not shed during menstruation is what? Is endometrium, myometrium, mesometrium, cervical mucosa, or rugae? What is correct question? The correct question is B. Is myometrium. Why? In general, we have two things to think about here. First, you need to decide if a structure is a part of uterus. If it is a part of uterus, then you need to decide if it is shed during menstruation. Myometrium is a correct answer because it is medial muscular component of uterine wall and it is not shed during menstruation. So others like cervical mucosa and rugae are not part of uterus, so that they may not be included in correct answer. I think you got it, guys. Let's go on second question. Extension of vaginal lamen around the intravaginal part of uterine cervix is the cervical canal, uterine lamina, fornix, rectouterine point, uterovesical point? What is correct question? Correct question is C. Is fornix. Why? Because the cervix is inferior end of uterus that projects into vagina. This means that vagina comes up and wraps around the cervix, creating vagina fornix. Are you catching how the vagina fornix is formed? Yes. If you catch it, there are multiple fornix at the top of vagina. We have anterior, posterior, and lateral. The cervical canal is pathway through the cervix to vagina. The uterine lamen is the hollow center of uterus. The rectal, uterine, and the uterovesical point are two peritoneal folds found in the pelvic cavity. Rectouterine point is a peritoneal fold extending across the floor of pelvic cavity from the sacrum, beside the rectum to the uterus. Uterovesical point is a peritoneal fold extending from the uterus to the bladder. And you guys, you have to focus on those explanation in green color. And if you want to know another choice, a reason why they are not correct answer, you have to read the white one. Let's go to the third question. Which of the following would be the most likely to be damaged by a stumble wound into ischio recta? Ischio recta, you have to remember, is the same as ischio anal fossa. 2 cm lateral to the anal canal. Is it a cross of penis, perineal body, pudendal nerve, inferior rectal artery, vesicular bulb? What is correct answer? Correct answer is C. Is pudendal nerve. Means that if you have a stumble wound into ischio recta fossa, 2 cm lateral to anal canal, pudendal nerve may be damaged. Let's take a look on more explanation for better understanding. Pudendal nerves found about 2 cm lateral to the anal canal. Therefore, it is the structure most likely to be damaged by the stem wound. The close of penis is anterior, not lateral, to the anal canal. So, in a question you have been asked a structure which is lateral, not to anterior. Perineal body is a structure found in a female only and is anterior to anal canal, not lateral. Inferior rectal artery is a branch of internal pudendal artery that drives blood to inferior part of rectum. It would not be injured by stabbing because it is located on surface of rectum, not 2 cm lateral to the anal canal. Finally, vesicular bulb is a structure of erectile tissue located on either side of vestibule of vagina, attached to the perineal membrane, so it would be anterior to the site of stabbing, not lateral. Let's go to 4th question. Lymphatic drainage of terminal portion of gastrointestinal tract may flow initially into either superficial inguinal nodes or prolactor nodes, depending upon whether the lymph is formed above or below the anorectal junction, muscular string of puborectalis muscle, pectineal line, white line, cutaneous zone. May you guess the correct answer? Correct answer is pectineal line. Why is it this? Pectinate line is place where the lining of anal canal changes from the skin to mucosa. It is also a landmark that divides the lymphatic drainage, vascular supply, and innervation of anal canal. Lymph coming from structures above a pectineal line drain to inferior mesenteric lymph node or internal iliac nodes. Lymph from structures below the pectineal line travels to superficial inguinal lymph nodes. Let's proceed to 5th question. Under normal conditions, fertilization occurs in which part of female reproductive tract? Is it infundibulum of the uterine tube, ampulla of uterine tube? Is it mass of uterine tube, uterine lumina, cervical canal? What is correct answer? Correct answer is B, is ampulla of uterine tube. But fertilization normally takes place in ampulla of uterine tube, but you have to remember in some circumstances fertilization can take place to other part of uterine tube or fallopian tube, but normally it occurs in ampulla of uterine tube. This is the middle segment of uterine tube and it is the longest and widest segment, I mean ampulla of uterine tube. The infundibulum is funnel shape distal end of uterine tube, and the zygomatic is the narrowest part of uterine tube which connects directly to the uterus. The uterine lumina is the site of implantation, not fertilization. Finally, the cervical canal is the peripheral of uterus at the inferior end. It would not be an appropriate site for fertilization or implantation. I think you catch it. Can we proceed to another question? I think so. Let's go. 6th question. Benign hypoplasia, which is excessive growth of cells, of which part of male reproductive system would be most likely to be interfere with the passage of urine? Is it periurethral zone of prostate, central zone of prostate, peripheral zone of prostate, ejaculatory duct? Seminovesical? What is correct answer? Correct answer is A, is periurethral zone of prostate. Why? Because you have to remember this. Remember that prostatic urethra travels through prostate gland. So, if periurethral zone of prostate hypertrophied, the nearby prostatic urethra will be included. The center and peripheral zones of prostate are not as close to urethra. If they enlarge, they could not restrict the flow of urine quite as much. Ejaculatory duct is duct formed once ductus deferens joins with duct of seminovesical. It passes through prostate gland, but its enlargement would have no effect on prostate or urethra. Finally, seminovesical is a circle on posterior surface of bladder, which is superior to prostatic gland. It produces seminal fluid, and changes in seminal vesicle would not alert the flow of urine. Question number 7. After agreeing to have a normal child, a man and his wife decided he should have vasectomy. What structure would then be surgically ligated? Is it ductus deferens, ejaculatory duct, epididymis, fossa navicularis, seminovesical? What is correct answer? Is ductus deferens. Why? In a vasectomy, the ductus deferens is ligated or exercised. This means that the fluid that is then ejaculated from the seminal vesicles, prostate, and barbourethral gland, also called corpus gland, has no sperm. The sperm simply degenerates in epididymis and blocks more ductus deferens. And you have to tell your patient that during vasectomy there is no big circumstances, because the sperm will not going to accumulate in epididymis. No, they are going to be degenerated. It would not be a good idea to ligate ejaculatory duct or seminal vesicles, because that might compromise the patient's ability to ejaculate. Just remember, another name for ductus deferens is vas deferens, so it makes sense that procedure to ligate this structure is called a vasectomy. Question number 8. Which part of structures does not differentiate from comparable embryonic structure in male and female? Is bulb of corpus spongiosum and vestibular bulb, shape of penis and labia majora, grains of penis and grains of clitoris, close of corpus cavernosum penis and corpus and close of corpus cavernosum clitoris? What is correct answer? Correct answer is shape of penis and labia majora. Why? Because the shape of penis is an analog of shape of clitoris. The shape of penis is any analog of the shape of clitoris, while labia majora is derived from the same embryonic structures as scrotum. The other 3 answer choices, like structures that came from comparable embryonic structures in the male and female. For more explanation, you can use Netaplate, Netabook 38-9 for a picture of homologous structures in males and females. I think you know Netabook. Question number 9. Which structure does not form part of boundary defining trigone of bladder? Is intraureteric crest, left ureteric orifice, right ureteric orifice, ulacus, urethra orifice? What is correct answer? Correct answer is D. Trigone of bladder is bounded by openings of left and right ureteric orifices. Superlateral and intraureteric rest between the openings of ureters and internal urethra orifice inferior. The ulacus is structure that joins apex of fetal bladder to umbilicus. After birth, it becomes the medial umbilical ligament. Question 10. Which structure is found only in males? Is it a anterior recess of Untitled Fossa, genital hiatus, ischiocavernosus muscle, rectovesical branch, sphincter urethra muscle? What is correct question? No answer is D. Is rectovesical branch is the one which is found on the males only. Well, the ischioana fossa is the third field space located lateral to ana canal and inferior to pelvic diaphragm. It has an anterior recess that extends superior to perineal membrane and the sphincter urethral muscle, and it is found in both males and females. The genital hiatus is also found in both sexes. It is the place where urethra, vagina, and the anal exit pelvic diaphragm. Ischiocavernosus muscle comprises the corpus cavernosum of penis or clitoris. Finally, sphincter urethra incises the and compresses the urethra in both sexes. Question 11. Which structure is outlined with contrast on CT managed computed tomography using intraperitoneal contrast material? Is it your ovary, prostate, rectum, seminal vesicles, vagina? Correct answer is ovary. I mean A. Rectovesical branch is a reflection of peritoneal between rectum and bladder. It can only be found in males because females has uterus sitting between rectum and bladder. You have to be clear here. Rectovesical branch is between rectum and bladder for males, but for females, in place of rectovesical branch, there is uterus. So you may understand that rectovesicular pouch is not available for female. Question 12. Prostate is often imaged using an ultrasound transducer placed in which location? In penis, perineum, rectum, urethra, urinary bladder? Correct answer is rectum. Prostate is located on the posterior side of bladder. Since the rectum is behind bladder and prostate, you can image prostate by pressing ultrasound transducer in rectum and pressing it against anterior wall. Then ultrasound transducer will be against prostate gland. Let's proceed on question 13. Which of the following is considered as a part of broad ligament? Is it mesovarian, ovarian ligament, round ligament of uterus, Suspensor ligament of ovary, uterosacral ligament. What is correct answer? Correct answer is mesovarium. Because mesovarium, mesometrium, and mesosalpinx are the three peritoneal sections that create broad ligament. Mesopharynx covers uterine tube and hangs below it to meet with mesovarium. Mesovarium covers ovary and ovarian ligament. It extends posteriorly from mesopharynx like a shelf. The mesometrium makes up the rest of broad ligament. So the correct answer is mesovarium, because it's only one we have in the choices. Question 14. Which of the following does not conduct spermatozoa? For example, during sexual intercourse. Which of the following does not conduct spermatozoa or sperm? Ampulla of ductus deferens, duct of seminal vesicle, epididymis, prostatic urethra. Correct answer is B. Is the duct of seminal vesicle. The duct of seminal vesicles carries seminal fluid, a basic fluid containing fructose. That fructose it has function of buffering, and in vagina in vagina and provide nutrient for sperm. The duct of seminal vesicle joins with ampulla of ductus deferens to form ejaculatory duct. This is the first place where seminal fluid mixes with sperm. Sperm is first formed in seminiferal tuberous in epididymis. They then travel from the head to the tail of epididymis through the ductus deferens into ejaculatory duct, where they mix with seminal fluid into prostatic urethra, through the rest of urethra, and then out of penis. So, all of other answer choice are places that are important for passage of sperm. Question 15. During the course of surgery for benign prostatic hypertrophy, means benign enlargement of prostate tissue, which includes the prostatic urethra, an electrical cutting device is inserted into penile, then prostatic urethra, to remove the hypertrophic tissue. The posterior wall of prostatic urethra is necessarily removed as well. Which part of male seminal tract may also be partially removed? Is it duct of seminal vesicle, ductus deferens, ejaculatory duct, fossa navicularis, seminiferous tubra? What is correct answer? Correct answer is C, because the ejaculatory duct travels through prostate and opens into the prostatic urethra. So it is likely that this duct might get removed or damaged during surgery. The duct of seminal vesicle and ductus deferens are two ducts that join to make the ejaculatory duct. They both lay on the posterior surface of bladder and would not be interrupted by surgery. The fossa navicularis is adoration in penile urethra to not be harmed by surgery in prostatic urethra. Finally, seminiferal tuberous are tuberous in testes where sperm are formed. Question. A 27-year-old woman is examined by her gynecologist. Upon rectal examination, a form structure directly in front of the rectum in the midline is prepared through anterior wall of rectum. This structure is cervix of uterus. Why? The cervix of uterus is anterior to the rectum. Since the cervix is inferior part of uterus, that is protruding into vagina, it should feel like a formal structure upon palpation. The bladder is most anterior organ in pelvis, in front of uterus and rectum. So the bladder would not be directly in front of anterior wall of rectum. The body of uterus rises upon the bladder, so it is too far in front of anterior rectal wall to be palpated. Pubic symphysis is joint connecting two pubic bones. It forms the anterior boundary of pelvis and would be too far forward to palpate through the rectum. Although the vagina is directly anterior to the rectum, it would not feel like a distinct and formed structure upon palpation. Question 17. The most inferior extent of the perineal cavity in the female is Prolactor Fossa, Pallavescra Fossa, Lectutrine pouch, Lectovesical pouch, Vescutrine pouch. What is correct answer? Correct answer is C. Lectutrine pouch. Why? Remember, lectutrine and vescutrine pouches are two pouches created by dropping the perineum over the pelvic organs. These pouches are two lowest extent of perineal cavity. So, to answer this question, you just need to decide which one goes low. Since the uterus is folded over the bladder, lectutrine pouch can extend to a slightly lower level than the vescutrine pouch, which makes C the correct answer. The Prolactor Fossa is formed by lateral reflections of perineum over superior one-third of rectum. This space gives the rectum room to fill with feces. The Pallavescra Fossa is a space near the bladder that allows bladder to expand. Why is lectovesicular pouch incorrect? It is only found in males, not in females. But if the question had asked about males, the lectovesicular pouch would have been the correct answer. But the question asked for the males. Question 18. The prostate gland contains upper, middle, and lower lobes. Exarchus utra is well imaged radiologically using intravenous urogram. Is extraperitoneal? Or the answer is B or D? Can you try? Correct answer is B and D. Means that prostate gland exarches urethra and is extraperitoneal organ. There are two true statements here. First, prostate gland exarches urethra. It cycles around the first part of urethra, the prostatic urethra. This is why urinary retention is one symptom of prostatic hypertrophy. If prostate is enlarged, it may cause around the urethra, including this passage and preventing urine from exiting the bladder. The prostate gland is also extraperitoneal. Remember, lectovesicular pouch, a fold of peritoneum that hangs between bladder and rectum, is the lowest extent of the peritoneal cavity in males. but prostate is found on the posterior side of bladder, below the parent where peritoneal membrane creates this fold. So it is extraperitoneal organ. The lobes of prostate are anterior, posterior, and lateral and middle. Therefore, finally, the prostate will not be imaged using intravenous urogram. In intravenous urogram, a patient is given for contrast, and the radiographic images are taken as contrast is excreted, passing through kidneys, urethra, and bladder. Since prostate is not part of this excretory pathway, it would not be viewed through this method. Question 19. A 64-year-old woman was diagnosed as having carcinoma of distal gastrointestinal tract. At surgery, lymph nodes from the sacral, internal iliac, and inguinal lymph nodes groups were removed and sent to pathology for study. Only superficial inguinal nodes contained cancerous cells. In which part of GRT tract was the tumor localized? In the cutaneous portion of anacana, distal rectum, mucosal zone of anacana, pectin line of anacana, proximal rectum. What is the correct answer? Is A. Why? The pectineal line is more than the line where the mucosal lining of the anacana changes to skin. It is also a key dividing point for the flow of lymph in anacana. Above pectineal line, lymph flows to the inferior mesenteric and internal iliac lymph nodes. Below pectineal line, lymph flows to the superficial inguinal lymph nodes. So, the pathology report tells you that tumor must be somewhere below the pectineal line, since the superficial inguinal lymph nodes are the only nodes involved. The only answer presenting a tumor below the pectineal line is A. Cutaneous portion of anacana. Proximal and distal rectum present a space far above pectineal line, and mucosal zone of anacana is by definition above pectineal line. At pectineal line itself, lymph should be flowing to all the set of nodes, and it will not be unlikely that a tumor at the pectinate line would involve only the superficial inguinal lymph nodes. Last question. Structure within the lower gastrointestinal tract specialized for physical support of fecal material are the transverse rectal folds, circular fold, ana valves, ana columns. What is correct answer? Correct answer is A. There are usually 3 transverse rectal folds in the lower rectum. These are specialization of circular layer of musculature that are designed to support fecal mass. Although circular fold is somewhat descriptive of transverse rectal fold, this is the best answer. Ana columns are longitudinal folds of the mucosa of rectum vessels. They are found on inner wall of anacana. Ana valves are folds of mucosa that join anacanas, ana columns at their inferior ends. Yeah, we are at the end of the first practical quiz, pelvis and pelvic viscera. Please don't forget to click on subscribe and leave a comment for improvement. In addition, please turn on notification by clicking to the bell of notification so that you may not missing any content. Thank you very much for watching this video, and may God bless you. See you later in next video. Goodbye.